Hey everybody, Tim White, clinical specialist here. I am here with Brooke, who is graduating today. Congratulations. Awesome. So Brooke has been a part of our out-of-town fast track program where any of our patients who out of state or even out of country can come in for a 1 week fast track. So Brooke, you did Monday through Friday of this past week with us.
Yep.
We are reassessing her today. She did absolutely phenomenal with her treatment. Brooke, when we first saw you, we took a history, and your situation was you've had 3 total surgeries on your breast, with the last one being the one that caused the contracture, correct?
Yes.
It was your left side that had contracted, and your symptoms were you noticed that it was firmer and it was sitting higher, right?
Yeah.
Any other things that you noticed, like symptom-wise, or things that happened right before you noticed you were contracted?
Yeah, I mean, it just was tighter and like kind of flat underneath this breast. It just felt like it just didn't look the same, and when I would raise my hands up, this implant would move up, and it was just kind of flatter and squishier, and it just didn't like. I'm obviously hypercritical of myself, so to me, they looked completely different,
Right.
And of course, my husband's like, they don't look that different. You really have to point it out. I'm like, no, that's not true. But yeah, it was. I thought it was noticeably different, and it was making me very sad because you spend a lot of money on surgery and you hope for the best, and it just didn't come out the way that I was hoping it would, and so I was, didn't know what to do. So.
Right. So you found us and
Yes.
you came in for the fast track. So Brooke's initial presentation when we evaluated her was she had a 1.3 centimeter higher breast on that side, on the left side. This is what patients will notice, and if anybody wants to do a self-exam right now, a quick test for are your breast implants good is look in the mirror and see, do you have more fullness towards the top of one breast? Does one breast sit higher, especially at the bottom, okay? And sometimes you can't see it as the owner of the breast because your eyes are always above your breast. Ask somebody to take a look at you and say, hey, look at my breast. Does one side sit higher at the bottom than the other? And squeeze it. The 2 signs of capsular contracture are squeezably firmer than the non-encapsulated side and higher on that side. So
I did have fullness here too. Like it was noticeably fuller on the top.
correct.
Yeah.
Which in extreme cases, in a bra or bikini especially, you'll notice that. Yours wasn't so severe.
Yeah.
But definitely
I noticed it
noticeable.
because when I stood sideways, I could see that this one was like fuller at the top. But I had to like stand perfectly sideways so that I could see the profile. But I could definitely see that it was higher. It felt fuller at the top too.
Gotcha. So today we're super excited because Brooke has done so good. She's achieved full symmetry and positional symmetry, meaning in just 5 days, her 1.3 centimeter asymmetry has now totally leveled out. We just measured her and took her picture, and your breasts look the same.
Yeah.
They're normal. So breast looks the same, improvement in softness. Now keep in mind, at the end of our treatment, we're not really done because Brooke is going to go home and do another 30 days of her own program and continue to see improvement. So today's not really the end of your treatment, it's the end of seeing us, and you've still got some more to do. But as of today, from a 0 to 100% softer, how much softer would you say the breast is?
Probably 50%.
50?
Yeah, which is what I had said earlier to the other technician, and I think the softness is 50%. Yeah.
Fantastic.
Yeah.
So in 5 days to be able to get 50% better, 100% improvement in position, you're going to continue to get that softening over the next 30 days. That should be fantastic. What we do with all of our out-of-town patients is we follow up by phone and by email. You'll shoot me some pictures, we'll take a look, and then we measure and you can tell me how good you are, and that will be it. So after 30 days, our patients ask us, and Brooke has asked, will this result maintain? Am I going to have to keep coming back for treatment? I mean, is this going to come back? The answer is probably not. Once you get a result, you sustain a result, and we also teach you, the patient, what to pay attention to down the road. So even though Brooke gets 100% better, simple things that patients aren't aware of, capsular contracture can be caused by going to the gym. Capsular contracture may be caused by going to the dentist. We educate patients on all those things. So Brooke, thanks so much.
Thank you.
We really appreciate your time. Congratulations. I'll follow up with you and see how good you did in 30 days.
Great.
Thanks again.
Thank you.
All right.
Thanks.
Anybody has any questions, give us a call. Take a look at the 800 number in the banner below. Like us on all our social media, and please subscribe to our YouTube.